Looking now at another country that has been so deeply affected by this crisis, according to UNHCR, even though I hate to give numbers, but over 1.1 million registered refugees, half of them children, are in Lebanon. Another similar number, perhaps, of non-registered Syrian refugees are in the country. Some initially there as migrants, that in addition to the very many Palestinian refugees who've been there for years. This extraordinary influx of refugees, just to put it in a little bit of context, would be something like 65 million, I believe. 65 million refugees here in the US, or a staggering 240 million in China. So this is how much Lebanon is taking. A third, some would even say a quarter of the population, which is 4.5 million in the case of Lebanon. Ghassan Hasbani, Deputy Prime Minister and Minister of Public Health of Lebanon, the figures, the ratios, I think, speak for themselves. GCFF is doing quite a bit to help Lebanon. I know that there have been projects to do with transport infrastructure, employment projects as well to help the Syrians and the Lebanese in the country, another project to enhance the resilience of the healthcare system. How far does it all go, though, in meeting Lebanon's needs? Is it substantial enough, or is it more on the symbolic side?
Well, thank you for this opening. Actually, just to correct a few numbers, for the non-official or unofficial, unregistered numbers, the percentage is actually the highest per capita in the world. We're talking about 30 to 40% of the population. So this is actually equivalent to more than 100 million people landing in the United States over a period of 3 years. Or just to put it into perspective, that's about 24 to 30 million coming to Canada in 3 years, or 10 million to Germany, and expecting the world to ask Canada or the US or Germany to find them employment opportunities, feed them, give them services, and treat them equally to their citizens. That's a colossal scale. That's a virtual impossibility, and let's face the truth. We're all doing our best to do that. But classical and traditional indicators for refugee situation and for dealing with refugee situations cannot be applied simply to the case of Lebanon and Jordan particularly because of the sheer scale of the problem. So we need to be creative. We need to go outside the box and find solutions. We have 500,000 youth unemployed. 30% of the youth in Lebanon are unemployed, and 50% of the Syrian youth, that's between 18 and 24 years old, are unemployed. This is a virtual time bomb. This is creating a lot of discontent and major issues at a social level. This is a global problem. It's not a Lebanese problem. The GCFF has been quite generous and quite creative. The donors have been very active and supportive. That has brought a lot of cooperation and visibility to the problem. However, it still falls short of what is needed. We have very ambitious programs and plans for Lebanon to be able to deal with this global situation, but a global situation like this needs a bigger and more aggressive global solution.
So you need more help from the international community. Refugees, I think, as you allude to as well, especially in the case of Lebanon, we've seen starts usually as a short-term crisis, but ends up being a very long-term issue for countries. You don't have the adequate international support, you say, but beyond the financial burdens that can be shared by others. To what extent is Lebanon dealing with the political barriers that face refugees in your country that simply do not have access for political reasons, many would argue, to the job opportunities that they need, the bureaucracy, the legal hurdles? What are you doing about those?
Well, again, this is the indicators I was actually talking about. If we use global standard indicators, the system stands to face many issues and problems. We could face a major social collapse, creating a bigger problem than the Syrian refugee problem in Lebanon. So we have opened up the opportunity to provide work permits. This is not alien to Lebanon because Syrians have always worked in Lebanon as a workforce, but now the numbers are simply much, much bigger than before. We're allowing this, but we're also dealing with a major discontent on the local population. Not just on the work side, but also on services. I'll give you an example. As a health minister, we see about 40% rejection rates in intensive care and pediatric intensive care for the Lebanese. So the Lebanese population is being denied a basic service because of the existence of a large number of Syrian refugees. And that has to be dealt with very, very carefully. That could create political problems, but the resilience of the system has allowed so far to accommodate for all this demand. What I'm saying is we have a plan of about $10 billion of investments that need to be put in the Lebanese infrastructure to bring it up to the needed capacity to cater for this amount of additional people. $10 billion, which needs to come in its vast majority in grants, because Lebanon is effectively the third country in the world in terms of debt to GDP. So if we don't get this kind of global support, the situation stands to deteriorate, and deteriorate significantly, as we have a high level of birth rates, we have an increasing level of demand on services and infrastructure, and a potential discontent at the popular level. I just want to thank the donor community, but I would like to remind them of one thing, that this is a collective global problem. We need to step up the support as much as you can, and we need to keep this in mind even when the conflict in Syria is resolved, because it is going to take some time for those people to safely return home.
Thank you very much, Deputy Prime Minister Hasbani.